In my 2018 SCVS presidential speech, which was, or address, it was on the invisibility or the anonymous nature of vascular surgery in the United States. And I suggested there are a few things we might be able to do to change that. One would be branding, which the SVS is finally now starting to address. And the second is to get an independent board for vascular surgery. And the reasons for this are multiple. One is the recognition of our specialty. In workforce studies in the past, such as the 2009 American College of Surgeons workforce study, vascular surgery wasn't even mentioned. In the lay press, such as the US News and World Report, which ranks specialties every year, hospitals by their best specialties. There are usually 16 specialties listed. Heart and heart surgery are on that list. Vascular surgery is nowhere to be found. So we're basically, as stated, an anonymous specialty to the public. And we need to change that. So that's one reason. As far as the respect portion of it, in departments of surgery throughout the United States, vascular surgeons often answer to general surgical chairs of surgery or other chairs of surgery with very little control of the budget process or the outline and planning of departmental priorities. And that's a big problem for a lot of folks, for a lot of vascular surgeons across the United States. And then in service lines, usually what they call cardiovascular, which is a term I abhor, but it should be heart and vascular. But either way, leadership in those service lines is rarely by vascular surgeons. We're not acknowledged. And I think that if we had an independent board, it is more likely that we would have departments of vascular surgery, especially in larger hospitals, but there would be a trickle down from that to smaller hospitals. And I think the level of respect would change for vascular surgeons on the whole. And departmental chairs have a lot more input into the selection of service line leadership than would a division chair of vascular surgery. So those are some of the reasons. Other reasons for an independent board are control of our training. Truly, the destiny of our specialty is in who we train, how we train, and right now we share our RRC for our training programs with surgery, the ABS RRC, and they review 5 different specialties, including general surgery and including us, and that's a lot. And there are only 3 vascular surgeons on the RRCS. And so we need to increase the number of trainees significantly because we're losing ground to other specialties that are training in procedures, peripheral and other endovascular procedures to fill a void in the United States for the increasing number of patients with peripheral vascular disease. And so we really do need to increase our numbers. We need to be able to establish specialized or focused fellowships in different parts of vascular surgery, such as aortic surgery, complex peripheral arterial disease, maybe even venous disease. So these are some of the reasons why we need to be an independent American Board of Vascular Surgery. And finally, to be a member board of the American Board of Medical Specialties, there are only 24 recognized independent boards. There hasn't been an independent board accepted to the ABMS since 1991. But when you become a member board, as they state in their brochure and in their online content, when you become a member board, they interact with payers and policymakers and hospitals and administrators. And that's important. We do not have that type of representation now, and I think that would be very important for us. Well, we have a reorganized American Board of Vascular Surgery, attempts at achieving an independent board This is not the first time around. Dr. Frank Veith and Jim Stanley and others tried to do this about 15 to 20 years ago without success. And now there are a lot of vascular surgeons, concerned vascular surgeons, about the future of our specialty. So we reformatted the American Board of Vascular Surgery, and now we have a large board of directors and directors. I am the chair of the ABVS, and we are now addressing all the potential negatives or we're trying to address potential negatives and questions about the ABVS, such as, will it cost too much? We're a small group, we're a small society, there are only about 3,000 boarded vascular surgeons in the United States. Can we afford an independent board? Well, other independent boards, such as the Board of Colon and Rectal Surgery and the American Board of Thoracic Surgery, are also small. Colon and Rectal's 2,000 members, thoracic the ASTS is 4,000 members. So we're about 3,000 to 3,500. And we looked at the costs by evaluating those independent boards and seeing what their costs were versus their revenues, both by looking at 990 forms, which are public information, and through my personal communications with them. And we estimated what it would cost us to do this. And we found that not only could we meet the cost, but it could actually be a little profitable, and it wouldn't cost our members a lot of money. It would be very reasonable annual costs, not more than they're paying now for their current memberships. Physicians can support this movement by contacting us through email at info.abvs.org, and you will certainly get a reply as to how you can move forward if you're interested in our efforts to make this happen. We're also, and I didn't mention this earlier, we're trying to work with the SVS to see if they would be interested in surveying the membership on this issue. At this time, it doesn't seem like they have a lot of interest. There is some concern that the membership may not be well informed about an independent ABVS versus the current status with the ABS and some of the changes they've made in a positive direction. So I think it behooves us to educate our members, and once educated, to have these members involved in possibly voting for whether they would like to proceed with pursuing an independent ABVS.